Hello and welcome to the first episode of our series highlighting current and exciting research projects in MGNet Research Consortium. My name is Helen Gurma and I'll be the host for today. I am joined with Dr. Barnett Tapia, Associate Professor at Department of Medicine, Neurology, and Institute of Health Policy Management Evaluation at the University of Toronto, as well as Brenda Colmenares, Associate Director of Communications at Every Life Foundation for Rare Disease and MG, as also MG patient advocate. In this episode, we'll feature Dr. Barnett Tapia's research project titled Treatment Preferences of Patients with Myasthenia Gravis. I now will give you both the floor to discuss this important topic and the myasthenia research.
Thank you, Helen.
Thank you, Helen. Hi, Carolina. I'm very excited to meet you and learn a little bit more about this project you're working on.
Likewise, always excited to talk to patients and hopefully bring the patient's voice to the table.
So, Carolina, can you tell us a little bit about what this research is about?
So, Brenda, as a patient, I'm sure you have been told or offered treatments for myasthenia many times, perhaps more than one treatment.
Mm-hmm.
And as I'm sure you and any patient that's listening knows, we don't have any treatment that is 100% perfect in the sense that will completely cure disease and also have no side effects. So every time we suggest you to take something like prednisone or another immunosuppressant, we're telling you, you may improve in certain things, but we're also telling you, there's a risk of weight gain and bone loss and infections. So every time we're deciding, and this is something that patients do and doctors do, we're kind of balancing out, the pros and cons of every medication. And until now, most of the research and most of the how we weigh this preferences is based from the experts, as doctors saying, we're really concerned about, infections.
Yeah.
And not always systematically assessing what are the things that matter most to patients. So our research is focusing on understanding how people with myasthenia make treatment decisions, how they weigh these potential benefits and side effects, try to understand what things are similar to doctors, and perhaps more interestingly, what things are more relevant for patients that doctors have and experts have not thought about or don't weigh as high in their minds.
That's great. Thank you. So what is the most important insight you have for me as a patient? And how do you think it's going to impact me and others who have myasthenia gravis?
So our project is not finished. We're in the finish line. We're doing the last leg. But we've already learned so much about what patients have told us that's important for them. So as a patient, that doesn't surprise you. You know very well, I'm sure, what's important to you.
Right.
But for the research and doctors community, bringing that patient's voice to the table so that doctors know, you know what? Yes, you may think that, and I'm just making this up, that weight loss, is not as important because, people don't go to the hospital, it's not life-threatening, but sometimes for patients, that is one of the most important side effects and something to consider. So that helps doctors think a little bit more in terms of side effects and bring this to the table. It also may help development. So that the world of myasthenia medications is exploding now. We have so many new drugs in the pipeline. But, for pharmaceutical companies to know that certain side effects are really, really, really bothersome for patients, and developing drugs that might reduce those side effects or limit them or don't have those side effects is also beneficial. So what we're hoping to achieve is down the line is that both clinicians and researchers and pharmaceutical companies use this information to bring better treatments, and also to help us discuss with the patient, this discussion of pros and cons, be a little bit more mindful of what in general patients are telling us.
I really appreciate this, Carolina, so much because my first treatment was actually prednisone without considering any others. And of course, I was new to this disease, so I accepted fully. And I didn't have myasthenia gravis symptoms, but I did gain new side effects. So I completely understand what you're saying. So this is a big deal for us. And Carolina, what is the future of your research? What do you see coming?
So after this project, what I'm hoping is eventually, once we identify, what are these main things, we're hoping that we may develop tools that can be used in clinic to help the decision making. So as now, especially now that we have so many new drugs, these conversations become more difficult because before we only had like 3 options, right? So there's not a lot to choose from, but with new drugs, there's a lot of information thrown at patients, and you're expected to help make a decision with your doctor, and it can be a little bit overwhelming.
Yes.
So what we're hoping in the future is to develop tools that either you can do on your own and bring to your doctor, and do together with your doctor, where you potentially can see all these different treatments and interventions and the pros and cons, and put your preferences, and hopefully it'll help refine what treatments are better for you as an individual based on this pros and cons that you have identified that are important for you. And the reason is that we know that patients are not the same. I have patients that are really hesitant to go off prednisone. They have very little side effects and they really feel a lot better. As I have patients who will never want to take prednisone again in their life unless their life is threatened, right?
Exactly.
So these discussions need to be individualized. So we're hoping that in the future we can help patients navigate these complex decisions.
Okay. And that brings me to a last question. For those patients listening, is there anything they can do to help support this research?
So if you are a member of the MGFA or any big patient association, we are going to do the last part of our research, which is a survey. And hopefully the MGFA is helping us launch, as well as other patient organizations. So the survey, we don't ask you just to tell us what your pros and cons. It's actually we give you hypothetical scenarios to say, imagine there's treatment A with this good and bad things, and treatment B, and we force you to choose. It sounds straightforward, but it's not, because we make this scenario hard to decide in between.
Oh, wow. Okay.
And what we're trying to aim is really, what are the things that patients value the most? So if you're part of a patient association, you get this email saying, we're looking for the survey. If you can spare the time, we would be really grateful. We want to get as many patients from different views and genders and ages, so our findings can represent, the vast majority of patients with myasthenia.
That sounds great. Thank you so much, Caroline. I'm sure a lot of patients will be interested in taking part in this.
And thank you so much for having me.
Valuing the patient voice. Thank you.
Thank you.
Thank you both so much. This was such a very fruitful discussion. I think it's really patients to hear out these research projects. We hope this will be a great resource for the MG community, and I thank you both for your time.
Thank you.
Thank you.